Well, it wouldn't be a week without COVID. I think that we're down to more like up until last week, we were still at 500 deaths a day. This week, at least in the last couple of days, I think it's more like 250, which is interesting.
Thank you.
But Boone's Farms, yeah. But so instead of just trying to maintain for a little bit right away, we got to take away a few more precautions. There's no more masks required in California hospitals or in New York hospitals, which is mind-blowing when you know that COVID is an airborne virus and people who are going to hospitals are already somehow compromised one way or the other. It just feels like we cannot get enough of this foolishness. I just don't know when it's going to end.
Well, we're so far from being out and protected from COVID for one.
Yeah.
So like a little dip in the numbers, which
Yeah.
we're obviously getting numbers not reported as much.
Oh yeah. Yeah. By the way, I think that was 13 states reporting.
Yeah. So numbers aren't reported as much.
Yeah.
The testing doesn't work as well. There is less testing. All the things that are supposed to raise red flag alarms, they don't exist anymore. So like, we're not going to get those metrics really that are like, holy shit, because they basically intentionally got rid of them.
Yeah, Johns Hopkins is no longer going to be culling all the data to put it up. So that was like one of the main places that we were getting all the data. They're shutting it down.
But the point I wanted to make is, okay, let's just accept that. Let's take their numbers at face value, that it is as low as, it's dropped to a point that is that low. Are you not going to keep hospitals a safe place for people that have comorbidities? Like, why hospitals should always it should permanently be a place where people wear masks, regardless of COVID, because it's where sick people are.
Yeah.
Like, and this is California, this liberal bastion, and we can't even fucking keep masks on a little longer than.
It's amazing. And there was another school shooting, and there might have even been two, but one at Michigan State, which is horrific. I mean, it's horrific. And gun violence is awful, but it doesn't even come close to the number of deaths where, 250 people dying a day is still pretty significant. If somebody came and shot up 250 people in our country every day, there would be massive outcries. I mean, that means every 10 days, 12 days, there's another 9/11. We still have emergency authorization from 9/11. We still take our shoes off in airports because of 9/11. We will never forget 9/11. It's happening every 10 days in our country.
Absolutely. And I just remembered when I was telling people about my my day, I also got news that my friend's kid got shot, and it didn't even make the news. That's how common gun violence is in America too. Like, it's just really fucking depressing.
It is really depressing.
Like, the one thing we have control over, like, we can wear masks. You don't have, it doesn't matter what your beliefs are on the vaccine or anything, but if we could just have a rational government that realizes on a basic level, a mask is a simple protection. It's not an infringement on your rights. Can we at least wear them in hospitals and on public transit so that immunocompromised people can live their lives? I mean, we have a national law on disabilities that says you have to have wheelchair ramps to, accessibility. So that's, we looked out for them to get into places. We can't look out so people don't just die when they go out in public.
I mean, and right now there's no plan to clean indoor air, which would be such an easy way of really, like, eventually then you really wouldn't have to wear a mask, right? But there's no plan for that.
It would cost businesses a couple $100.
Yeah. And monitoring, which we see with the railways, they're not going to monitor, right? So like, you'd have to change out the filter every couple months and monitor the oxygen levels and all that kind of stuff. They won't do anything. I mean, they just won't do anything. So they lie, and they put out that Cochrane study that people are still citing, which has been so debunked. But it doesn't matter because you just keep repeating a lie and people start to accept it. Well, masks don't work. The vaccines don't work. COVID's not that bad. I mean, it's just the lies just keep getting pushed out. And more and more they're seeing that the more you are infected, but even one infection can have lifelong repercussions. And I think most people just are really not aware of that. Although they've recently, I guess it was on what is it, what is her name? Hoda, the morning show, one of those morning shows. There was like a 7-minute segment about the rise in cardiac arrest and strokes with young people, like the 18 to 39 or 35-year-old group, that corresponds to rises in spikes in COVID, clearly not because of the vaccine, because it started before the vaccine even came. So these rises in cardiac arrest are because of even mild cases of COVID, even asymptomatic cases.
Yeah, and I think if you're somebody who's going to attribute these myocarditis and other illnesses, sudden deaths to the vaccine, why would you not also acknowledge that it's COVID? Because the way vaccines work, it just gives you a teeny fraction, smidgy bit of the real thing, and it only stays in your body for a short amount of time. Like most adverse reactions to a vaccine are within 48 hours. Some are within maybe 2 months, but at that point, all the vaccine is out of you. You don't have any of the vaccine in you. Where COVID is in you in a massive dose, in a lot of cases, and it goes everywhere and doesn't clear your body like a vaccine does.
Right.
So if you could see this little teeny fraction of a thing causing harm, but
Right.
not the big thing,
Yeah.
you really have an agenda, or something is driving, so your emotional logic is stronger than your actual logic, because
Yeah, and unfortunately, we have no fourth estate and no working government. So, I mean, I understand people are distrustful, they're frustrated. There is no plan being put out there. And again, 250 deaths a day. And it's so interesting because I will see liberals write about abortion. Like, if you're not pro-choice, I'm a one-issue voter. Like, they're really all about, they're fine being purity politics, right? If it's guns or abortion, which I'm fine. Like, I'm fine with purity. That means you have standards that you have. But like, if it's anything else, if it's healthcare that kills tens of thousands more people than gun violence, as horrible as gun violence is, that's a bridge too far. We had have to take slow steps, pragmatic steps. It's not going to happen that way. You have to convince more people. Maybe if you said it more nicely to me. I mean, they have all the reasons that they're going to run cover for the Nancy Pelosi's of the world or the Biden, and act like it's not just as evil to ensure through your policies that there are needless deaths.
Well, COVID really exposed that there's no side fighting for us. So if you're like on the fence about third parties, neither of these parties, I mean, COVID is the only thing that got Biden elected. It was the people that thought maybe he'll be better on COVID, put him over the edge.
Yeah.
And now that the people that voted for him for that protection, I mean, think of all the people with long COVID. You think they're voting for Biden? Like, I mean, maybe, but nothing about COVID convinces them. Like, they're not going to think that.
Yeah. He handled it well.
This is great. They're being ignored completely by the entire administration. And that includes Bernie, who's the fucking chair of the Health and Human Services or whatever it is in the Senate. He now.
Yeah.
So, I mean, people were saying, well, he's got the power to subpoena anybody he wants to go before the Senate. And that's great. And I hope he will, but he hasn't been critical of anybody on COVID. So any sort of push in that respect, I just don't see it happening.
Yeah. I mean, if you can't get healthcare in the middle of a global pandemic where they're saying that a third of the deaths in our country, we're at 1.2 million, and I'm sure that's an undercount, can be blamed on the fact that we don't have universal healthcare, and they're still just marching forward, getting people back to work. Yeah. I don't know. Where's the ruckus? Bring that ruckus.